Well, how am I api? Yushki awachin kampi, chante washte napi chuzabelo. My name is Guthrie Capicella, and I greet you all with a heartfelt handshake. I'm from the Standing Rock Sioux Tribe and work here at Mayo Clinic, focusing on tribal outreach. With me today is my colleague, Karina Sabaku, and really excited about today's topic. Thank you all for being here. What a wonderful turnout today is. All right, I'm gonna start sharing my screen. Everybody, oh, let's get rid of that. There we go. Okay. And folks, thank you all for being here. Please, this is one of the largest Indigenous health topics we've had. So there's a lot of new registrants. Please go ahead and introduce yourselves in the chat, name, organization, which tribe you're from, if you're affiliated with a tribe, or where you're calling in from. Welcome. Happy Friday for another Indigenous Health Topics here at Mayo Clinic. Quick housekeeping items for you all. The presentation today is going to run until about 1 o'clock. After that time, we'll have Q&A. As we're going, please do drop questions in the chat, and we will go in the order that they came from at the end. Not in the chat, my apologies, in the Q&A function at the bottom of your screen, not the chat, in the Q&A function. Apologies. All right. And really excited about having Megan Lhotka here with us today, speaking about the health and history of Indigenous peoples and the impact of colonization. I'm gonna stop talking now. I'm gonna turn it over to the star of today. Happy Friday, everybody. Megan, thank you for being here, and I'm gonna give it to you.
Rich Guthrie, thanks everyone for being here today. It's overwhelming to see all of you. Well, I can't see any of you, but your names rolling over in the chat is just very overwhelming. So thanks all for taking the time to join us. Yeah, so let me share my screen. The technique that we have to do here. All right, here we go. So today we're going to be going through a history of Indigenous health. We're going to start with pre-colonization to present day. And I'm doing this as an independent consultant of Ojibwe with Minanakwe LLC, which is my independently owned consulting company. Hanin Minanakwe Indigu, Makundu Dame, Gawababiginakag and Dun Jaba. My tax name is Megan Lhotka. I'm from the White Earth Band of Pembina Ojibwe. I'm a first-generation descendant. My father, Frank, is an enrolled member of the White Earth Band of Pembina Ojibwe. The Pembina were relocated from the upper portion of what is now Canada and Minnesota, North Dakota, to Red Lake and White Earth. So that's where my family originated from. These pictures kind of tell a story about who I am. I'm a cultural trainer through Mintrek for the state of Minnesota. I've traveled around the state for the last several years doing curriculum, language, and cultural consulting. Here's a picture of my partner and I, Tony. I have 3 amazing children, Nadonis, Elliot, Nij Ngozis, Jake, and Osh. I'm a proud auntie of 15 nieces and nephews. My logo for my company is in the middle there. I'm very proud of that. And also my favorite place on White Earth Reservation is White Earth Lake. I grew up going there with my siblings and fishing and swimming, and there's a little private beach that the tribe owns that we got to go to and things like that. And now I'm fortunate enough to rent a seasonal cabin on White Earth Lake and bring my kids there in the summer as well. And I wanted to say miigwech, bizendawayeg. Thank you everyone for listening today. So let's get into the timeline and the history of our health. And today when I say our health, I'm speaking of Native American and Alaskan Natives of the Americas. And if I say Native American or American Indian, I'm speaking of our population, our relatives. Okay, so today we're going to start 1491, pre-colonization. Then we're going to move into 1492, first contact, 1500, Spanish contact, 1600, Pilgrims arrive on Wampanoag land, 1776, American Constitution, 1800, Indian Health Service, American Indian Removal Act. Some of these topics might seem political, but as we move through them and you hear this explanation, you'll understand how the US government and politics does affect our health. So in 1491, consisted of a varying population of 8 million to 112 million. And this picture is a picture of pre-Columbian era. This is of agriculture, major urban centers, mounds and pyramids, irrigation, farming land. Some of these sites in South America were archaeological features that have charcoal records used to reconstruct biomass burning history. And that was able to mark us to about 2000 BC, which showed that Native Americans were in Americas a lot longer than history had thought previously. And so the researchers here started studying how we lived through these findings and started varying that on and based it on the population. So there was a lot of us on the East Coast and the Midwest of North America. And then you see a lot of us on the Southwest and then Central, which is Mexico, and then South America as well. And then the upper portion of North America would be too cold to occupy, reflecting this photo. So then we move into 1492, and we have the first European contact. So Columbus hit the Central Islands, and with the first European contact also came smallpox, measles, influenza, and typhus. And these illnesses were unknown to Native American immune systems. And so this first contact also brought first devastating waves of diseases, lowering our health and lowering our numbers. Our bodies didn't know how to fight these off. Our medicines didn't know, our medicine keepers didn't know how to treat them. It was devastating for our populations at this time. And then fast forwarding to the 1500s, this map represents more, maybe more modern day perception of tribes in the subarctic region, through the Great Plains, the southeast, the northeast, southwest. Mesoamerica, the Caribbean, etc. So here we see established tribes across the America, and the estimate of the population at this time, according to Newson's research study, is 15 million to 59 million Native Americans inhabiting these lands. So from 1492 to 1500, we're going to kind of go through and see what was going on at that time. So now we're in the middle of our timeline of our health. So in 1500, we had Spanish contact. So in the Southeast, in the early 1500s, colonization was beginning. There was, this was kind of the first contact following the 1492 discovery of Native America. With this early contact, it really brought uncertainty to our people in the Southeast and our relatives of the Choctaw and the Atlantic Ocean region. In 1513, we see Spain claim Florida, and this is the first major European land claim. Native Americans are converted to Catholicism, forced labor, and intermarriages. And the natives endure these changes to preserve a traditional way of life. With this, smallpox, typhus, influenza, and measles prevalent with this colonization. And according to the Smithsonian Institute, the population of North American Indians at this time was 1,894,350. So we made a major drop from 1492 to 1513 because of impact of disease. So if we're moving into Mesoamerica and the Caribbean, we're seeing in 1521, the conquistadors and the Aztec Empire. So this is when we're seeing a lot of slave ships coming in. We're seeing a lot of African Americans being brought into the Americas. We're seeing what is now Mexico City being taken over by Spanish rule. This brought down the Aztec Empire with a 93-day battle. They were forced to surrender, and then 95% of the population passed because of a smallpox outbreak. And then from that time into 1620, up on the East Coast, I think probably the most notable point in history, or maybe something that, mainstream academia teaches us in elementary, is Europeans land on Plymouth Rock. And the Wampanoag were the first North American tribe at this time. They were a semi-nomadic community that thrived on traditional life and healing practices. And the Europeans who came and landed on Plymouth Rock were in desperate need of medical attention when arriving on the homelands of the Wampanoag. So a prominent figure in this time in history is Squanto, and he was an interpreter. And he worked with the pilgrims and the chief, and they arranged for the healers and helpers to care for the sick and dying. So the Europeans started with about 107 when they left their homelands and when they survived the first winter, they had about 37 people left. The healing came from traditional medicine of the people of this area. Chief Masasato formed treaties with the new settlers, and he did that for goodness of his tribe and goodness of the new people on the land. They taught them the ways of farming techniques, land cultivation, and how to survive the elements. And food sourcing was also taught by Squanto, how to hunt, what to eat, what not to eat, plant medicines, things like that. So these sick and dying strangers were taken in and healed through traditional healing practices, traditional food ways, and traditional ways of life. I think that is an important part of history that gets missed out, and so I just really wanted to emphasize that in this presentation today. So what are the impacts of colonialism and health? Over this time frame from pre-colonization to 1620, we see conquest, enslavement, missionization, loss of tribal dynamics, immunity, and exposure. So we have a lot of different things happening to native ways of life, traditional ways of life. When we see stress, war, impact, slavery, relocation, we see dietary intake lowered, we see nutrition levels lowered, we see disease rise, and we see mortality rates rise as well. So the first part of our health sets the tone for our health. So now we're in the mid portion of the 1600s and America becoming a country. America's a little baby country right now. And from 1492 to 1650, the population of Native Americans throughout Native America diminished from 50 million to a little over 5. And their own demographic disaster that holds parallel in world history. Yeah, I see the reaction. So this presentation has really been a journey for me and a reflection of resiliency. So here we are in the year 1776. The American Constitution was signed, creating treaties. And if you're from Indian country, you're familiar with a treaty. And who did these treaties affect? What is a treaty? Why do treaties matter to Native American health? So let's talk about it. Who does a treaty affect? A person enrolled in a federally recognized tribe. And what is a treaty? Treaties were agreements by the United States government to provide goods and services for lands owed by said tribes. And why? This is how the government continued to control Native American populations and services were considered food, shelter, and medical care. So when America became a country and Native Americans occupied lands, the treaties put us onto smaller portions of our lands, which are known as reservations. And within the reservations became treaty rights, and goods and services were considered food, shelter, medical care, hunting and gathering, um, minimal needs of Native populations. And now we fast forward to the year 1800, and we have the Indian Health Service happening. And at the same time, we have the American Indian Removal Act. So let's get into that. But before we do, I forgot to mention at the beginning that this presentation can trigger a lot for some of us. And I just want you to be aware that if you start to feel heavy feelings, make sure you're taking care of yourself in this space. Okay. So in this time, the United States government was providing health services through the War Department. And this was, oops, sorry guys. Thanks for all the love. So IHS was being provided. So IHS, when I say that, Indian Health Service, was being provided through the War Department. So the goal of IHS was to contain diseases near military forts. So when you think about a military fort and who occupies them, which would be soldiers, officers, potentially their families, and then forts also bring populations of settlers, which brings towns usually. And then we see opportunities for trade and bartering and other sources of resources like food, shelter. And so the War Department recognized this in 1824, and they're like, we need to do something about this because there's a lot of disease happening within these small areas around our forts. And they decided that they're going to start treating the Native Americans. In 1832, they started vaccinating Native American populations near the forts with smallpox vaccinations. In 1849, Indian Health Service was transferred to the Department of the Interior. And this health service was under the obligation of treaties to provide these goods and services of healthcare. So now we're going to work our way from 1800 to 1850. And we're going to see kind of I want you to look for some similarities over this timeline. There's a lot of things happening to Native Americans. So we see the War of 1812, Tecumseh leads on the British side, Lewis and Clark expedition of 1805, which was led by Sacagawea. The Trail of Tears, where the Cherokee people were relocated to Oklahoma in 1838, the American Indian Removal Act, the Mexican War in 1848, and the once the US established as a country, they started doing a census. So the US population reached 31 million in 1860. Out of that 31 million, 4.5 African Americans were considered. 4 million of those were enslaved, and Native Americans were not citizens or counted in the census. So even though all these things were taking effect, we're still not citizens or counted in census. We're just simply placed into areas where they could just kind of keep track of us at this time, kind of manage us a little bit better, I would say. And then also in the 1800s was the boarding school era. In 1819 was the James Monroe Indian Civilization Act. And some of you may be familiar with the term kill the Indian and save the man. And what they wanted to do was civilize Native Americans to whiteness. And they wanted to do that by taking away culture, remove from family units, relocate them to different parts of the country to become assimilated into Christianity and white culture. And some of you might be wondering, well, what does school have to do with health? As we know, when children are exposed to trauma at an early age, it has significant impact on their health later in life, both developmentally and mentally. So from the boarding school healing website, I wanted to show that the child removal systems, and some of them go a little more present date, past our timeline that we're on right now, but the records of Indian boarding schools are scattered in public archives and private collections across the country. And as a result, we don't know how many total children were actually removed from their families and placed in boarding schools. But they do know that in 1926, the Indian Office estimated that 83% of Indian school-age children attended boarding schools. And so some of them died or went missing. Some of them never returned home. There were harsh conditions with abuse, neglect. They were forced to be white children. And so I can just imagine how conflicting that would feel, to be taken from your family unit to kind of a institution type setting with strangers, and then be told that who you are is wrong and how you act is wrong. And I just the mental and emotional anguish for those children would just take such a toll on their mental, spiritual well-being. So through the 1800s, we're seeing a decline in culture, family structure, medicine, language, mental well-being, child rearing population. Our life expectancy is going down because of disease, relocation, war, and the boarding schools. And then we're seeing a rise in disease, mortality rates, a loss of identity, assimilation, abuse, and mortality rates again. So once we get through the 1800s, we're now into 1900 to 1960. In the 1900s, the population of Native America done by the federal government was 237,000. In 1921, the Snyder Act solidified funds for Indian health by the government. In 1924, Native Americans became citizens of America. In 1941 to 1946, Native American men and women warriors served in World War II. In 1950, forced assimilation and relocation life expectancy. Oh yeah, forced assimilation and relocation was happening. The life expectancy of a Native American was 44 years of age. In 1950, so from 1900 to 1950, our population did grow to 350,000. And in 1960, the Red Power movement is happening, which I think highlights the awareness and that the resilience piece coming into play. And then termination policy, loss of culture, identity impacts, and assimilation. So things that were happening in the 1800s continue to happen all the way up into 1960. So we're well into hundreds of years, and we're still seeing the same things happening to the Native American population. All right, and now we're into 1970. And we're seeing the Religious Freedom Act, where for the first time, Native Americans are free to celebrate and hold on to sacred and religious items. In 1980, Congress issued the Indian Health Care Improvement Act. In 1990, the population grows by 37.9%. President Bush claimed November as Native American Heritage Month. In 2000, we see a population boom, and studies show that more Native Americans are now identifying as Native Americans. In 2010, 5.2 million people identified as American Indian. 30% of Native Americans lack access to adequate health care. In 2020, Native American communities face the highest health inequities compared to other populations in the country. So now let's go through these timelines. I believe that I should have been a 1970s Indian because I would have loved to have been part of AIM, and I would have loved to have been part of awareness, and it's just something that I'm just so passionate about. Plus, I would love to have a t-shirt that says Indian Power. My uncle had one, and I have a picture of him wearing it, and him and my dad just look so cool. So a lot of good things are happening in the 1970s. We have awareness with AIM. We have the Indian Healthcare Improvement Act of 1976. In 1975, there's a new Hawaiian medical school, and they graduate the first 4 Native Hawaiian doctors. Their ICWA starts in 1978. But then we still have the continued disparities and inequities happening in our health. So 4 out of 12 IHS regions admit to sterilizing full-blood Indians. So what they did was they singled out Native American women who had a full blood quantum and issued them to sterilization without them knowing. And in 1979, there was a diabetes pandemic in Indian country. The study in this shows that the food sources that were available to the regions to the native populations in the Southwest didn't fit the needs for their native bodies, causing obesity. And with the climate that they lived in the region of the desert, the diet that they were used to genetically and the diet that they were given with the subsidies, commodities and such, their bodies weren't able to break these foods down, causing this diabetes pandemic in 1979. Relating it back to the displacement, the lack of food system, the lack of traditional way of life, etc. So now we're seeing the effects of colonization, treaties, reservations, loss of land, loss of foodways, loss of culture, up to 1979. So now we're going to hit the middle of 1980 and 1990. We see a big change in identity. We see a lot more in the census, and this information I pulled from the NIH studies of census and population. From 85, so the census is done every 10 years. So from 1980 to 1990, the population of Native Americans rose significantly. And I feel like this has something to do with the Religious Freedom Act in previous years. People finding like culture and identity in community, in each other. ICWA was able to start bringing Native children back home. Native children were being placed in Native homes. We were seeing more awareness with natural foods, natural foodways, traditional medicine practices, and people were identifying more as Native Americans. Growing up as a Native American youth with my parents being raised by the generation where it was not okay to be Native, the change of identity happened more for my generation later on in the early 2000s. And so now it's time to understand what types of health disparities do we see in our communities? why we see them, who we see them in, and what we can kind of do about that. So, major health disparities we see are heart disease, diabetes, and cancers, and chronic health conditions. Now we're about mid-90s, 2000s. And why do we see increased health disparities in Native Americans? So the research is showing the effects and impacts on health in association with the historical trauma, and social and emotional stressors create higher risk of disease. So the article that I cite here was done by a group of Native researchers that did a cohort of Native Americans that had fathers and mothers that attended boarding schools. And what they found was that if you had a father that attended boarding school, there was a higher rate of chronic disease as an adult. So if my dad, for example, if my dad had attended boarding school, I have a higher chance of having chronic disease as an adult. Again, that article cited. If you want to look more into that, it's very interesting. And then I'm sorry, I can't read. Who today has health disparities? So this chart shows a comparison of communities, a comparison of race, a comparison of age, and a comparison of socioeconomic status. So if we just start up in the left-hand corner and work our way around, this is health and healthcare for AI and AN in the United States. So as of 2017, over 5 million people, or 2% of the population, identified alone or in combination with another race. And most of them live in 10 states. That's what this says. So they compare it, more likely to be poor compared to white people. More likely to have a full-time worker in the family. Non-elderly adult, fare worser than whites across many health measures. Physical limitations, obesity, it's just, you can just see that the blue is American Indian and the gray is the white population, and the dark blue is the unmeasured. And you can see that over all of these things, the American Indian population is higher and more likely, or far worse, than white people to have health disparities when it comes to race, age, and socioeconomic status. And if we're still wondering why, the timeline that we've been going through today is the contributing factor. So how do we help the scenario? How do we help our Native patients? How do we treat the health disparities? In Native American cultures, a common thing that we see is the medicine wheel for balance. a holistic approach to medicine and healing, with mental, physical, social, and emotional aspects. And I think all of us can be culturally immersed if we take the time to get to know our populations that we're working with, if we are an Indian country. We we have many um, researchers, reports, articles, journals. We have many great books. We have talking circles. We have community socials. All those things can help you to better understand Native people and what they may need. And then getting to know your Native patients is also a huge advantage in their care, as far as asking questions like, how do you identify? You may look at me and think, if she's Native, why is she so white? And I would tell you, it's my grandfather. It's not, it's not because I'm not Native. It's all about how you identify, self-identification. When we're with Native people, showing up for them is important, and the reciprocity and care as well. Meet you. That's what I have for today.
Wash day, Megan. We've got a flowing sea of hearts and clappy hands. Folks, we still have time for chat and questions. And I'm going to go down the list in the way that they came in. Not every, oh, I don't want to be spotlighted. Jeez.
Yeah, you can be spotlighted, Guthrie.
Hold on here. There we go. All right. All right, here we go. I'm back in action. So questions we had today kind of starts way back at the beginning. If Squanto served as interpreter, where did he learn English?
So a lot of those things are like okay, so Squanto was a semi-nomadic person, and he was a hunter-gatherer. And so he had contact with various tribes. So he roamed around and had contact farther down the line, farther down the coast. Learned skills along the way with that contact.
There's a I think we found you another speaking opportunity with Reno down there in the chat. I don't know if you want to connect with Reno, Charlotte, or share it.
Guthrie, can we address one question that's come up multiple times? How do people get the presentation or video?
For our internal folks at Mayo Clinic, we'll have the videos will be up on our intranet page within our video sharing within days. Folks, we're still trying to migrate our videos to YouTube. I wish it was an easier process. I thought I had it down, and then I got the spinning wheel of death as we were trying to migrate those. So the plan still is to migrate everything to YouTube. We'll probably have to put in a ticket for some support. I'm hoping that we can get those on soon. My plan was to have them here before Megan's presentation, but Megan's presentation will be uploaded as we upload the rest into YouTube. and I will be sure to communicate it out with our distribution list that we have. So if you've registered for Indigenous Health Topics and are on our distribution list, you'll get a notification of when that'll happen. Otherwise, you know, in the future, we can drop the links to where it lives on YouTube within the space. Thank you for bringing it up, Karina. I almost have that down and memorized. It's been asked for the last 3 months that we've had it, and I'm just sorry we haven't gotten there yet. As a vegan, I'm very inspired by the Indigenous teachings connected to earth and stewardship. Oh, where'd it go? Oh, we just went down. All right, questions keep coming in. I love it. Can you elaborate on Indigenous farming practices like Three Sisters and sustainable plant-based lifestyles? Thank you. If that's going to happen next month, perhaps just tee that up.
Yeah. So the Three Sisters Garden is a planting practice that was done by several tribes. But it's a mound. So the way I was taught, a mound. So you fertilize the mound with fish and rocks. And then you plant corn in the middle. You plant beans around the corn, so the beans grow up the corn. And then you plant your squash around the outside so that that protects the corn and the beets. And it has room to grow out.
Thanks, Megan.
Yeah, and the next part of the series is medicine. What did we say, Guthrie? What did we call it?
Oh gosh. Part 2. Give me a second. I think it's revitalizing Ojibwe practices of northern Minnesota, something like that.
Oh, yeah. Yeah.
Part 2. Yeah. Thank you, Sydney. So next one is going to be really focusing in a lot more on the medicine. This was much more related to the history and our relation to colonization and the health impacts. Nick asked a really good question about Indian boarding school records. He said, what type of private collections keep Indian boarding school records? Are these owned by families or institutions that used to lead the schools?
So a lot of it was like churches. And I'm really sorry, but I don't have it cited, but I will add it before we send it. But the National Boarding School Healing Coalition website has a huge they have a lot of that information. And if you have family that you're missing, or if you would like to know if you had family that attended the boarding school, you could go to that website and, oh yeah, thanks Guthrie, it's right there. Check that out and kind of start your digging. I would say digging when I'm looking for I'm sorry, I shouldn't say that when I'm talking about the boarding school stuff. When you're starting, how can I say that better? I'm so sorry. Yes, Minneapolis was the start of AIM. I'm gonna change the subject. Investigating. There we go. When you start your investigation. There we go. Thanks, guys.
Trying to get punny with the boarding school stuff. Kind of sad, kind of sacred all at the same time.
Yeah.
It's okay. No, I do want to reinforce what Megan said. A lot of nobody keeps records like the Catholic Church keeps records. That is the greatest record keeping organization in the history of the world.
But
And there's a lot
nobody
there.
nobody loses them when they've done something wrong like that Catholic Church either.
They can definitely pivot fast, those guys. It seems like there should be additions related to health impacts, such as U.S. policy that puts nuclear plants and uranium mines and allows corporations to build oil pipelines near or on or near reservations. And this is causing cancer and other illnesses and polluting water sources. So not so much a question, but I think
Addition.
the destruction of our environment through contemporary things such as nuclear plants, as we see at Prairie Island Indian Community, the pipeline that we see running through up north, as well as over in Standing Rock. Completely agree. And then Karina being Navajo down in the Southwest, they've got a whole other, it's just everywhere. It's all over. It's all the time. It was a very good comment by an anonymous attendee at 1238.
And when I was putting this together, I was trying to be really intentional about the timeline of our health and putting into place the history behind it all, because we're really at a time again in history where politics can have an impact on us again. And from those timelines, it is a complicated history, and divvying it down into those short timelines, and me pulling what I think is important, and anonymous viewer voicing what they think is important, and us in this community talking about what is important is part of our culture. And so all of our views today, all of our connections are important. Our displacements, our relocation, huge environmental impacts for all of us.
Here's I would like to see how the ACEs score fits into these stats. Mental emotional health is a real impact to overall health attainment. ACEs, the ACES. If anybody has that one, adverse childhood experiences survey. There we go. Oh my gosh, I remembered it. Another great comment. I think, the science is catching up to things that we know. We didn't need to have an ACEs score to realize that boarding school was detrimental to community and individual health. But my gosh, it would really, it would have been nice to have that after kids got home from boarding school. Oh, here's a good question from Anthony. Anthony asks, being a new transplant to Minnesota and an immigrant to the US, who do I connect with to develop authentic relationships to support substance-related service research? Oh, geez, really went after it.
Substance-related research?
I don't know if Anthony is at Mayo or not. Anthony, are you still on the call?
Are you Mayo? Are you
Okay.
Mayo? Okay.
Anthony, just shoot me an email.
Yeah, connect with Guthrie and he'll help you.
Yeah. All right. Hey, I see people dropping for the top of the hour. Before you guys go, or as you guys go, we got the survey for today. You guys will get this in your email tomorrow too. But all right. So Anthony's going to connect. Where are we at? Okay. Sorry, guys. I lost my Q&A function. There we go. Back up. All right. Generally, though, sort of like Anthony's question, for substance abuse, right? Like our tribes will have, many of them have their own substance abuse and departments within their health departments that work on those things. And so, you know, if you want to work within a tribal space, there's tribes to partner with. If you want to work in an urban space, there's organizations in the urban space to do that with. But just expanding. Jen asked a really good question here. Can you discuss disparities, if anything, involving mental health issues and substance abuse among Native people?
So when we see populations with high impact of trauma, it correlates with high usage of substance abuse, dealing with, or I shouldn't say dealing with, self-medicating because of traumas. Now I am not a healthcare provider that can give adequate substance abuse advice or information. But I can say that historical trauma, substance abuse, intergenerational trauma, things like alcoholism, addiction are all genetic. And those have been found in studies and can be treated with cultural practices and Western medicines.
The balance, like you were talking about. All right, where are we at? There's some really great comments in the question, but not all our comments, or not all our questions. What are some additional strategies furthering health equity for improving my gosh, you guys, it's Friday, I forgot how to read. What are some additional strategies furthering health equity for healing and improving health?
Strategies for improving health equity? And what?
They're looking for strategies for healing and improving health.
For themselves or Native care?
No, that's a good question. Well, they're talking about health.
Yes, Bonnie, outside, nature, water.
Oh, the answers are coming in there.
Yes.
Power
We know how to take care of each other. Oh, that is one thing too. I was gonna say, Native people know how to heal Native people, and that's why our roles and our voices are so important in these spaces. Culture is the medicine. That's what I always say. Language is the medicine. Culture is the medicine. They took it away, but I'm gonna be loud and bring it back. Yep, Autumn, exactly.
All right, last question that we've got in the Q&A here is, thank you for sharing this information about root causes. What strategies do you recommend people to take to influence our corporate leaders to take impactful action versus performative steps?
So this is a tough question to answer because I think all of us are trying so hard to find this right approach in education, in healthcare, in housing, in urban communities and rural communities. It's how can we tell them that this is important? just as important as non-native people. And I think maybe the answer really is that we are people. Why do you want to dismiss a section of the population because of a race or identity? Why don't you just want to take care of people? Why don't we just want to heal people? Why don't we just want to educate all of us? I don't have that understanding. I don't have those teachings yet. I'm still looking for them as well.
Oh, all right, we got a question. I'm looking. Oh, I have lowered my hand. Oh, okay. All right. I saw hands up, and so I was like looking for additional questions, but sounds like all were accidents. Anybody in the chat have additional questions today? I'm looking forward. She really did a great job of setting the stage for our next topic, or for her next presentation of revitalization. I'm looking forward to 1 month from today, March 28th, we'll have our second. Guys, this has been, just a really amazing turnout today. I can tell that we have a lot of support for our topic and our speaker. This really has come in. I connected with Megan through Indigenous Health Topics, but these topics that we're having are because of the survey feedback that we do have. And so, continue to provide suggestions of both topics and speakers within those survey pieces, because that is how we get folks like Megan to be up here, is through, Karina and myself looking at those surveys and saying, oh, this is a good topic. Last year we had native birthing practices, and that was one that was asked for a while. And traditional medicine is one that we've had brought up several times. So when I get the slides from Megan, I will send them out to the attendees from today. And then again, we'll continue to work on trying to get these videos uploaded to YouTube. Who knew that this was a difficult, challenging task? Apparently it is not straightforward, but as soon as they're on YouTube, I'll be sure to let everybody know. And then, yeah, just going to drop it back in the chat again and remind folks about the survey. Please do take it. Like I just said, we look at that data. It's good to see so many new folks today in the chat. I thought it's felt like over the last 2 years, we built a good community here, and really happy to welcome all the new faces in here as well. So look forward to seeing you all in a month. Megan?
Yeah, thank you, Megan. I was just gonna say that was a really awesome conversation. I think you're gonna need to either make a t-shirt, a hat, or a sticker that says Native people know how to heal Native people, because that was a really awesome way to end.
Oh, Miigwech June Blue. I really appreciate that a lot.
Megan, do you want to say goodbye to everybody?
Oh, yeah. Gigawabaman, Manawa.
All right. Well, Doksha Ake. Karina, you want to say goodbye to everybody in Navajo?
I'm going it.
Well, we'll see everybody. And Megan, when I end this, it's gonna kick us off the call. So thank you for coming today, and I'll talk to you soon.